In this video, I will be explaining the safe procedure in administering medication to a patient. Locate the patient and the patient's medication with a MAR chart. Check the patient name, address and date of birth and cross-check with the information on the MAR chart. It's Monday morning. Place the MAR chart on a flat surface and line the patient's medication up against the MAR chart using the names on the medication boxes. All the patient's medication should correspond to the MAR chart. If you are missing any medication or have spare medication, then contact the pharmacy. Turn the medication over to show the prescription label. The first slot on the timesheet is the once-weekly medication. It is good practice that non-daily medication such as weekly or every 3 days appears first on the MAR chart. Read the dosage instructions for the first medication on both the MAR chart and the prescription label. Both should correspond. In this case, the weekly medication is to be administered weekly on a Thursday. All instructions should be clear and easy to follow and should state the day of administration. In this case, it is Monday the 23rd and the alendronic acid is not to be dispensed today. Place the medication back in the storage box out of the way. The time is morning. Look at the date, which is Monday the 23rd. Take note that the previous day dosages have been signed and that today's dose has not been administered, as there is no signature in the slot. Read the dosage instructions for the first medication on both the MAR chart and the prescription label. Both should correspond. Locate a dispensing pot and place the first tablet in the pot. Place the medication box back in the drawer. This will ensure that we will not redispense. Move on to the second medication on the list and follow the same procedure as with the first medication. Move on to the third medication on the list and follow the same procedure as with the first and second medications. As a final check, the number of tablets on the MAR sheet should correspond to the number of tablets in the pot, 3 in this case. Check with the patient their name and date of birth. Tell them their medication is ready and consent obtained. Once you have observed the patient taking the medication, sign the MAR chart. Thank you for watching the training video on medication administration. Goodbye.